At some point, your movement disorder provider or primary care doctor may offer you a referral for palliative care or hospice.
Palliative care referrals can be made as early as when the diagnosis is made, and again later in the disease process.
Simply put, palliative care focuses on helping individuals with a serious illness have the best quality of life for as long as possible.
At mHealth Fairview, palliative care is whatever you decide it should be to fit your needs.
A referral is placed and you meet with the palliative care provider, usually by video for 80 minutes.
In the first visit, you discuss your goals for care. It can be a one-time visit or many. The return visits are 40 minutes, also mainly over video.
Palliative care is the glue that puts all your care together. In these long visits, you have time to talk through decisions and process. Just because your movement disorder specialist, urology doctor, or heart doctor recommends a treatment,
you may not want or need to do it, especially if it doesn't match your end-of-life goals. You may discuss symptom control, which may include pain, sleeping, or even how to manage changes in the way you act.
Think of it as a quality of life support program for patients with serious medical problems like Parkinson's. Palliative care is also the place to discuss your end-of-life wishes or even get a pulse.
Some questions they can help you with include these. What are your hopes for the next 5 years? What worries you the most? What are your cultural, spiritual, and religious beliefs, and how can they be honored?
What makes life worth living? If you can't live on your own or at home because of memory or movement problems, where would you like to live?
What does the best place and best care look like for you? These are just examples of things you can discuss with your palliative care team.
Often, palliative care visits are just as helpful for the care partner. They can talk to you about caregiver burden and resources. They may even open your eyes to other options.
While palliative care refers to another layer of care in addition to medical care, hospice is different. Hospice is a change from life-prolonging care to end-of-life care.
It's focused on comfort. Hospice is for a person who has 6 months or less to live. While no one can perfectly predict when death will happen, there are some clues that tell us it's close.
Trouble breathing when at rest, needing to stay in a wheelchair or in bed, going from normal to not speaking clearly, needing a lot of help in daily tasks can all be clues.
So are not eating or drinking well. Continued weight loss and health problems like aspiration, pneumonia, sepsis, pressure ulcers, and UTIs that keep coming back.
These are all signs that you may be ready for hospice. Moving to hospice is often hard for caregivers who have been caregiving for many years, keeping the person well and in a get-better frame of mind.
Care partners may be in denial about their loved one's condition. Some people are shocked when hospice is brought up. They may have been adjusting to the slow progress of the disease.
Each loss of their loved one's functioning becomes the new norm, and they just get used to it. Care partners may also be afraid of what will happen when their loved one's gone, and they may not even be aware of their fear.
But once the full-time job of caregiving is over, they will have their own life to think about. Obviously, there will be grief over the loss of their loved one, but the loss of the meaningful activity of caregiving, as hard as it can be, is also huge.
Choosing hospice means we stop trying to cure illness using medical treatment, and we let the body go down naturally. Comfort measures or symptom relief is the #1 goal.
Many of the medicines the person is already taking for Parkinson's can help. Without these medicines, there would be pain with muscle stiffness.
Whatever helps the person's comfort would continue. We can aggressively treat anxiety, which is a common companion for many with Parkinson's. Hospice provides care designed to meet the person's needs while dying.
In a Washington Post article in 2021 about Jimmy Carter's decision to go into hospice, Robin Given wrote, "Hospice care is not a matter of giving up.
It's a decision to shift our efforts from shoring up a body on the verge of the end to providing solace to a soul that's on the cusp of forever."
The hospital team includes doctors, nurses, on-call 24 hours, home health aides, chaplains, spiritual care people, and social workers.
As whole beings, we can be in distress physically, emotionally, and spiritually. That's why the team includes people with different skills.
They can help with hiring in-home caregivers, finding an inpatient facility or residential hospice home, music therapy, massage therapy, and bereavement support for the family after death. Medicare pays for many hospice services.
When the person is on hospice at home, hospice staff are not in the home 24/7, but are on call for emergencies and any questions that come up.
They give the family comfort, medicine, and explain how and when to give it. You can ask for an at-home hospice consult at any time so you can prepare for the future.
If you're not sure whether it's time for hospice, ask your doctor. They can place the referral, and a hospice nurse can come to your home.
The nurse can look at your situation and answer any questions. You can always change your mind, stop hospice, and enroll again later.